I want to welcome our viewers to a very special podcast. We're on the Kennesaw Happenings. We always talk about community because community is so important in life. But today we have a real doctor that's going to give you just his perspective. And I want you to think about some of the things that will be shared today. And then if it applies to you, great. If it doesn't, hey, that's okay too. So I'm going to ask Dr. Sarma to really introduce himself and who he serves and who he's with so our listeners can have an idea who they're listening to.
Thanks, Pete. It's my pleasure being here. It's my privilege. Thank you again for the invitation.
Absolutely.
So I work in primary care. I am currently working with Partner MD, which is the concierge practice that I work with. And I've been here for about since February of this year. And prior to that, I had my own private practice, and I was doing integrative and functional medicine as well as primary care. And here, luckily, they've given me the liberty to do the same. So what integrative and functional and primary care is for a lot of people, it's basically a holistic approach to primary care. Mm-hmm. And so, in terms of my philosophy as far as practice is concerned, one of the things, your word community actually encapsulates really well what I've found about the spirit of the current practice here at Partner MD that I work with, whether it's the community of the staff and the office management. We all kind of recognize that the therapeutic aspect of a concierge practice is that, everyone is applying to the therapy of wellness for the individual patients. So that it goes from whether that's the physicians to the nursing staff, to the office manager, to the health coach, to the front desk assistant. There's this consistency in terms of orientation and care for a patient, which, I've worked in corporate medicine for years. I worked, of course, in my own practice, and I was trying to deliver that as much as I can, but it's harder to do when you're on your own as a solo practitioner. And also doing administrative roles. Having the spirit of that, I find the spirit of maintaining a love for people and being able to deliver quality clinical care that's also robust and with the capacity to incorporate things like, what is your diet like? What kind of lifestyle stressors do you have? What medications are you taking? What medications are you not willing to take? What supplements are you interested in potentially taking? What supplements could be useful for your condition? What can we do from a preventative perspective? More than anything, it's kind of redefining the word health to be more as much subjective as well as objective. So from my perspective as a conventional physician, I've been a hospitalist. I worked in primary care for years. I worked in a psychiatric facility as a hospitalist as well. So, the objective means doing the necessary blood work and, vital signs measurements and so on and so forth. That's the objective criteria that we all look at and we all make decisions out of. If someone's cholesterol is high, for example, or someone's thyroid is off. The subjective are, what are the other stories behind that? One story comes to mind, I remember from years and years ago. It was a great story. I met someone who was getting her commercial driver's license in Arizona. I was working in Mesa at the time. And she was worried because she drove bus, and so she was worried that she might not pass because her blood pressure was too high. So she was worried about basically potentially losing her job. And, we talked for a little bit, and, of course I gave her the right kind of medication, and the next time I saw her, it was still a little bit high, so a little worried. And then I left her with a story. And I won't go into the details of the story, but it's a story about monkeys and like kings and how the mind plays a big role in the fear factor of everything. And we both got a great laugh out of it, still adjusted her blood pressure medication. And a couple of weeks later, hadn't heard anything. And then I got a card saying, thank you very much. I passed my commercial driver's license exam, was able to keep my job, and I didn't think of monkeys. So it's like it's just those kind of relationships that you can cultivate where the aspect of therapeutics is not just based on here's a medication. And I think that's one of the things from a concierge perspective that I found very, very endearing to me and aligned with my philosophy is you have the capacity here, you have the people who can support that and the system that supports that capacity to have the time for those conversations, and also the structure that allows for, you know, common sense and practical medicine to be practiced as well. But maybe hopefully that answered the question.
No, that is very good, because our listeners, you know, when it comes to the concept of concierge, they might have heard of it.
Right.
And certainly concierge has a lot of different meanings, but I wanted to just ask you this question because it came up when I first talked to Melissa about my situation, and she carefully talked to me about my priorities and things. And so she recommended that you would be the perfect fit. So then we do a Zoom, and you immediately start asking me questions, and I'm going like, my brain's not firing because it's not used to that many questions, because under the old system, it's, you know, it's fun, you know, they go so fast. It's like, you feel like you're in a speed drill trying to go through the waiting room to the doctor to the, you know, all the through. Okay, see my assistant. And it's like, oh, can you slow it down just a little bit?
Sure.
Our viewers, y'all's philosophy about how many people, you don't have to get into the numbers, but the basic concept of it's not turn and burn, see 200 people. What is your, to the viewers, how can you share to the viewers the singleness of care that you give to your patients versus maybe the old system that they're used to? Just like the big stars, the Well Stars, the Emrys, and things like that.
100%. So the beauty of it is I can't see more than like, you know, 8 people a day, which means if you look at, and I've worked in bigger systems, and I've worked where I've had to see 20 people a day, 22 people a day. You know, giving qualitative attention to people so that they feel seen and they've heard, in addition to making sure you're making the right practical decisions. That's what I find most commendable about concierge. It's like you have the time to devote yourself to looking at someone's medical records, kind of getting an idea before you're about to see them, like some of the questions you may ask them, and like kind of more focused towards customizing and personalizing the medical decision making. And you know, you have it's the right word. There's more of a freedom because you feel like you have a lot of time. You have time to get to know that person. You have time to cultivate a relationship. You know, I have the time to cultivate a relationship. That's like such a precious thing nowadays, especially when things are very, very fast. I mean, I can think of 1 or 2 or 3 or 10 of my patients, and I know where I'm going with each of them from both the immediate perspective and also the long-term perspective, because we're also focusing on health. And right off the top of my head, I'm thinking of someone who's got a little bit of prediabetes with some cholesterol issues. So, and he's not that open yet to medications, which is fine. Nothing wrong with that. So then we're using the supplemental approach, and then we're also using the dietary approach, and then we're also making sure that the health coach is on par with him, but also keeping the maturity of knowing if something is not moving in the right direction. Sometimes a pharmaceutical remedy is the right approach. And keeping, you know, that having that openness for those kind of conversations make people more open to the possibility of, oh, maybe the pharmaceutical is the right approach because we've tried so many things. In a turnstile system, it's a lot harder to do those kind of like customized care. So, you know, you have like literally 10 minutes to talk to people about basically what medications they're on, and then what you're going to adjust based on their blood pressure, and that's it. I've never resonated with that philosophy, and I think, you know, because I think that doesn't take into account really looking at people based on what they need. And so that's why I found that this has been a perfect fit for me, because, you know, I do have a half an hour, or if I need a 1 hour visit, I have that 1 hour visit, or if I need to make a phone call during the day just to say, hey, how are things going? It's been a couple of weeks since I've heard from you. You know, and doesn't need to have a big visit, but are you doing okay? You know, those kind of opportunities are what I love about practicing concierge, and one I would recommend to any physician who I think resonates with that approach. Yeah.
And, you know, just for our viewers, I wanted to give them a personal perspective of things, because when I came to see you, well, first we talked, and then I came, and I don't know how long it was, but it was a long time that you were getting to know and talking and taking notes and all. And then I mentioned to you that I had really not taken any of my medications except for for an aspirin in about 90 days. Now, that's not good, but I just had been fed up with the change that I was going through, and I just had given up on it. So when you shared with me, we were going down the list, and you said, how about if we dial it back and we start at a milder level, or whatever that word would be, and then let's monitor things. Then I took my blood test, and I about fell off my chair when you called, because I'm going, what? A doctor's calling me? What the heck? That's like 50 years ago we heard that. And so you're going over my markers and you're talking to me about it. And so I don't have to go through a nurse who's interpreting it through a doctor. I'm talking to the person who understands. And I love what Melissa said. You guys, you have a quarterback.
Right.
So a quarterback is the guy that runs the offense for our viewers.
100%.
Nobody's a football fan, but
I'm a
anyway.
big Falcon fan, by the way, so totally get it.
Yeah, okay. So, you're quarterbacking my health. Then all of a sudden, we're going over the markers. I go back on my medication, a lighter dose. I'm OCD to begin with. So you don't have to tell me to do anything if I believe in it. I do it to the T. Cross the T, dot the I's. I haven't missed. I take my blood. What is it? You put around your arm, blood. Yeah, monitor. I do that every day.
Yeah.
And so I'm now more confident because, be honest with our viewers, I've always believed in a holistic approach, but I know that there's a application for pharma drugs, but there's also a saying, and somebody said on one of my podcasts, skills before pills. Mm-hmm. So if you can get the skills, which would mean how I eat, what I do, my lifestyle, my environment, then maybe I don't have to take as many pills. I mean, that makes sense to me. So now I think I'm on a great path. My question to share with the viewers is your engagement with your patients. Walk them through what your philosophy is as far as your engagement after like the first time you see them. What can they expect?
So, the first visit, and I think this probably falls really well with the entire concierge model.
Mm-hmm.
For me specifically, I'm going to be looking at their medical conditions, and I'm also going to be looking at dietary aspects and potential lifestyle aspects and so on and so forth. But if you're talking about after the first visit, we're usually getting a set of labs. Then there's going to be either a follow-up, and depending on the nature of those labs, if it's like multiple things where I'm like, I want you to come in for a visit, let's talk this through. If it's mild enough where I'm like, I think a phone call will suffice in this case, and I think a personalized touch will be like being aware of what level of attention do I need to pay? Do I need to pay the level of attention that requires a visit where we're going to do a lot of medication and supplement adjustment, or just a simple phone call where I can say, everything looks great. This is the only thing that I see, and I want to talk to you about this. And then have a game plan in terms of like, okay, now I want you to be seeing the health coach over the next 3 months, 6 months, and so on and so forth. As we're doing that, repeat the labs again in 3 months or so just to see where we stand, or have a quick check-in. I make that invitation to everybody. I was like, even though I say 3 months, that invitation means like, if something is bothering you, or if you have an acute visit, or if you have some stressor or something, you're just like, Doc, I just want to talk this through, come in, send me a message if you need to just say, hey, I want to run this by you, or what do you think about this kind of article or something like that, right? So there's a little bit more humaneness in the relationship.
Right.
One of the difficulties of conventional medical, especially primary care practices, is it's a numbers game. And I learned that even though I was running an insurance-based practice, holistic primary care, I still learned it's a numbers game. If you want to make a certain amount of overhead to pay for all of the things and then make some living on top of it, you have to have a certain number of people. The thing with concierge is you can drop that from like 20 people a day to 8 people a day. And so, but that 8 people get more qualified attention as well as the rigorous the standards of a primary care practice in clinical medicine. With, again, here, because we have an emphasis on health, with the robustness of like the coaching and the dietary and lifestyle approaches. I mean, one of the best things for me is to be able to walk down the hall and talk to Dr. Francisco Carranian and just say, and he's our PhD exercise physiology health coach, and just say, hey, what do you think about this? What do you think about this the supplement for this person? Or what do you think in terms of medication? What kind of progress are you seeing? Well, so that interrelationship between, I don't have to do everything myself as the doctor,
Right.
but it's a team effort
Yeah.
towards health, because health is very subjective. And I've had to learn that you can't just put a lab test on health and say, check, which I think a lot of conventional big systems say. We still do the necessary things that are required. We do recommend the colonoscopies at the right age. We recommend the we do the osteoporosis DEXA checks. We do the vaccinations. So we do that, but we also offer a lot more. And I think that's the beauty of this particular practice with Partner MD. To answer your question.
It's interesting because my friend, I'll give a shout out to him, Walter Stump. He's told me about your concept for at least 10 years. Now, he's up in Richmond. So he came down here to visit, and I was sharing my frustration about some things. And he said, I bet you there might be a Partner MD in town. I said, why don't you check? So he checks and he sees, yeah, there is. Because what's interesting for our viewers to know, there's a waiting list of a year up there, because a friend of mine, his brother's friend, has been waiting a year to get into the practice up in Richmond. So we know it's a growing concept. And if I know correctly, and I may be just guessing on this, I think Melissa told me this, I'm not sure, that two of you were hired pretty close.
Correct.
So it opened up a lot of vacancies.
Correct.
Is that true?
That's correct. That's Dr. Jennifer Tutt, who was hired right before me, and then I got hired after that. So we are taking new patients. She's remarkable. Great.
Yes.
So go ahead.
No, I was just going to say, just to let people know, this concept is not like started yesterday. He was telling me for 10 years, and I always told him, I said, well, that's a great concept. But until it hit me personally, and I was frustrated that he made the phone call and hooked it up. I talked to Melissa. Next thing I know, Melissa recommends you because of your holistic, balance. And I said, that's what I wanted. And then sure enough, it's been nothing but great care. And I think for our viewers, it's not like concierge just started, but understand that in today's world, it's really, especially out of COVID. I mean, there's so many problems that came out of that. But just getting back to the concierge and your approach with Partner MD, if you're in Richmond and you're listening to this, you better get on the waiting list, because you're not getting in right away. Now, if you're down in Atlanta, okay, there's some capacity. And that's wonderful, because we talked about this one time, about it's almost like finding a needle in the haystack, because a lot of my friends have told me, two of them in particular, Pete, I'd leave in a heartbeat, but I have X amount of years with, the big one here. So I can't leave. I mean, it's like pension, all this stuff. And so they have to look for the right person that doesn't have 30 years experience. So with your private practice, you had experience in the big, then you had your private practice. They probably looked at your resume and talked to you and go, oh my gosh, let's get them on board as quickly as can, because it's hard to find the right doctor at the right time that matches what y'all believe in. So for our viewers, understand this. Opportunity knocks on your door. You cannot open the door, but you can also just say, nah, I'm happy with where, and if you are, you can be happy with it. I mean, that's your decision. Everything is a personal decision. 100%. And I have to give a shout out to Francisco. My gosh, what a compliment there. He's going to be on a podcast when he comes back from vacation. But immediately we started talking and he shows me Glucose Revolution. I said, I'm about 3/4 of the way through it. He goes, oh, good. And so it was just his approach. Now I'm journaling everything I eat, everything. I'm eating vegetables first. I know what's going into my body because I have a journaling system and I'm OCD, but that's beside the point. But the point is, you two together, oh my gosh, I think like I'm on cloud nine, to say the least.
Really been a gift for me to work with him, and we have
Yeah.
excellent health coaches throughout our system. But the best part for me is it transitions from that disease-centered model towards a health-centered model. Like, you have the stability and security of having an MD on board, but you have a very skilled motivator who is really up to date with all the latest and greatest, and also very skilled with supplements and exercise modalities, as well as dietary modalities, who can give you alternatives where the whole therapeutic effect is like enhanced multifold. So it's like, I can't say enough, like, having him here makes my job a lot easier, because I know he's really working to help people achieve health, which means I don't have to worry so much about, do I need to titrate their blood pressure the next time? What kind of medication am I going to be working with over here as far as their blood pressure, blood sugars are concerned? So then I know he's keeping them engaged and active in their health. Going back to what you said, everything is a personal choice. One of the most classic phrases that I use is the food industry is an industry. And we all know what that means, going back to the your friend that you had mentioned. So even though, the industry has its own practices, what our bodies are doing based on those foods is a whole different ballgame. Our biochemistry will not tell us something other than what it is. Right. Exactly. So with that, he's the perfect complement to institute all the strategies to say, how do you make sure that you're making the right choices with all but not so great choices out there? Right.
Because for our viewers, the environment that we're in and what we put ourselves in, whether it's eating or anything, has a lot to do with our health. So everybody knows that. But when you can balance it out, and that's just what I like the most, not the most, but there's a lot of things I like, that you have a holistic and a medical, and then we go over to Francisco in his area. So you got nutrition and exercise, and he's PhD, and he's got a lot of, I think he had something before he came with it. He had his own practice of some sort, because we were talking about journaling, and I mentioned bullet journal, and he goes, oh my gosh, he used to be a client of mine 5 years ago. And so I went, no way. He goes, yeah, right here. He showed me on it. So I was journaling everything and putting everything down, because breakfast, lunch, dinner, I put it all down. And then when he comes back, I'm going to bring my journal in and we're going to discuss it. That's how personal it gets.
I love it.
To really get down to, what do you put it in your body? Because if we don't know what we're putting in, how can we make changes? What you don't measure, you can't control. So, and he was encouraging me. I was first thinking, oh my gosh, I got to write down everything I eat. But I went back to my partner and he goes, Pete, he had sent me a bullet journal. So I already knew it. So I said, I'm going to put this more in play. And sure enough, it did. And all of a sudden, it really helps me to think before I put something in my body, because I'm going to journal it down. And I've noticed my energy levels have gone way up, way up.
Beautiful.
I'm feeling better than I ever felt in my life. Beautiful. So it works.
It works. And that's the thing I really emphasize, both from from his work as well as what I try to do with people. I love the diet diaries, basically. That's my term for it. If people can qualitatively feel the difference between when they eat a certain way and then they shift something, and a lot of people who have died, they already know this. Like, their experience of feeling cleaner, their experience of health is the evidence. I don't have to do a whole bunch of tests. They feel better. I will do tests just to confirm it,
Right.
They feel better. And so orienting towards that place becomes vital, because then that feeds itself. And you have some people here who are supporting you to maintain that.
Yeah.
That's where it becomes hard. Once you reach that, some people are like, oh, okay, I can relax for a bit. And then kind of a pattern will come back and back and back. Again, not a judgment about it. It's just recognizing our tendencies. And then you have the right people here to say, wait a minute, I see this is happening. What happened here? And then you go back with a diet diary, or you just say, I stopped doing the diet diary, whatever it may be. And then you just say, okay, so what is it going to take to bring you back into that focus so that health stays the focus, becomes not a lifestyle, but your actual life.
It makes sense so much. And I want to, for our viewers, because I know you're busy and I want to let you go, but one more question for our viewers. Really, I don't want to see a 1-year waiting list in Atlanta, because I live here and I have friends. So let's speak to the physician that's in your position, had his own practice. You had been you went to your own practice, right, carrying all these hats, trying to do everything, right, plus see your patients. Can you speak to other physicians that might be out there trying to do their own thing, and what you've seen in the transition to what you're doing now, and how you've been able to maybe family life balance or care, or whatever you can share with our viewers?
If I can share a story about that.
Yeah.
So if I'm talking to other physicians, and actually I will even say even professionals.
Okay.
So I remember she was probably, at that time, she was 10 months old. And so my little one, I was very knee deep in my practice, and I was tired. And, I was doing the admin stuff. My wife was also working as an office manager. So it was a very small practice. We really, we were growing quickly, but then I could see how much of myself was being invested at the expense of something else. And my daughter looked at me one day, and she realized I wasn't really there that much. So she stopped playing with me right then and there. And I was just like, am I gonna live this kind of life with her? Am I gonna raise her with being this level of tired, this level of like, do I want to do this? Is this healthy? Is this healthy for me over a period of the next 2 years, 5 years, 10 years?
Mm-hmm.
It was clear, right? It wouldn't be healthy for her as a caregiver, as a parent.
Right.
And so that was my moment to say, okay, well, what kind of practice would fit the kind of lifestyle I would like to live? And so from a physician perspective, and I speak with a lot of physicians, I love the lifestyle that I have as a concierge practitioner, because I know that I can do the work that I want to do. And a lot of times physicians will carry their work home, especially if they're in a corporate medical practice, and they're carrying it for a couple of hours at least at night. So then sleep gets lost. So their own capacity to maintain their own health gets lost. And I've talked to a lot of folks who are in the physician world who are burnt out, as well as professionals. So it's about making those choices that actually, both from a personal perspective, from a family perspective, from a health perspective, from a financial perspective, because you can't exclude that either, and saying, this looks like the best fit. And then, like the stars aligned, I got in touch with partner MD and the chief cultural officer. And it was it's easy to say the word magic as a cliche, but it was magic.
Right. And I believe it, because I understand that transition and how you can just focus on your patients. You don't have to focus on the marketing, the admin, all the things that a business owner has to be concerned about, because you're carrying a lot of hats.
Yes.
So
I learned a lot. I love it.
Oh, sure. I'm sure you did. And it came probably at a good time, because you already knew the big practices. Yes. I mean, the big healthcare systems. Yes. So it wasn't like you came out and then you jumped into your own business. You knew the difference between the two. So that's important.
I was looking at some of that, like, do I go back to this? But I already knew what kind of lifestyle I would probably be living in.
Yeah.
And then I was looking at sustainability. And I'm very honest about using my own health as an example. Sometimes just in the communication with patients, I made choices based on my health. I wanted to make sure I was living a cleaner, cleaner way. So they wanted to eat better. I wanted to be able to do, my meditative and mindfulness practices. They want to have the time for that, but I also wanted my family time.
Right.
So making those kind of choices when you're in your 30s and that kind of things, you can choose certain direction.
Right.
As you get older, you're moving towards your 50s or your 60s. You have other things you start choosing.
Yep.
So helping orient people towards that, I love, but also practicing preaching that is also, I think, just as important.
Well, we won't do this. We usually put a link in the show notes for people to contact our guests, but we're not going to do that because you're focused on your patients. But we will put Melissa's link so they can check and talk to Melissa because she's the one that can match and talk to them about their needs. And you can just take care of the patients and do what you do best and not have to explain a concept to somebody. But so for our viewers, just go to our show notes and you'll see Melissa's information. You can contact her no matter what city you're in, because I think she's out of Greenville.
She's out of Greenville. That's right.
Okay. So Richmond, Greenville, Atlanta, and I think like Baltimore or something.
And a couple of places in Virginia. More than just Richmond. There's Short Pump and there's.
Oh, okay. Yeah, that's right. There's 3 locations because I'm familiar with Richmond. I lived there for 20 years. So I know exactly. And for our viewers, we're going to have he's a golfer. So he's going to be on a different podcast, but your marketing person, Chris, belongs to the country club that my friend that recommended you guys to me. I mean, that it doesn't get any better. I mean, when we talked, because he wanted to make sure that we're not some way out there podcast, because I think he called him and said, hey, I'm interested. And so we talked for a few minutes and he goes, yeah, I'm playing with this guy, Stump on Saturday. I said, oh my gosh, that's my friend's nephew. I said, that's crazy. And he's a 6 handicapper, Chris is. So I said, man, we can't have you on the general podcast. You got to be over in the golf side because we're going to talk golf. And so he goes, oh yeah, we'll have some fun.
We'll have to teach me more about golf because you have to forgive me. I don't know enough about it. So I'm not going to pretend.
Oh yeah. My partner doesn't like golf. But he likes the other side of golf, which is the people you meet and the fun thing that you have with it. But I'll have guests that'll say, well, Jeff, you ought to start golf. And he'll go, no, thanks. Look, I'm in enough pain in some other areas of my life. I don't want to add to my pain. I'll just meet you at the 19th hole and we'll talk and have a fun time. So not everybody has to be a golfer, but we have a golf podcast too. So anybody that's golf related, that's in a different area. This is community related, and we're broadcasting out of the Overture, which is a 55 and older community, which interesting enough, I forgot about that. You spoke at one of their locations years ago.
Yes, I did. Wonderful. This was still when I was running my practice. And Christina is the coordinator. Great place, great people. Some of my patients still come from there.
Yes. I mean, they're always looking for good speakers.
If they're listening, I miss them. So
yes. Well, I tell you what, I'm going to share, Christina, this is for you, because I called her because I was going to say, Christina, guess who I'm having on my podcast Friday? And I said, I don't know her. I know her sister. So I said, if you want to join us, just call me back and we'll see what we can work out. But I'm sure she might be on vacation or something like that, but that's okay. But I know that
I'm going to reach out to her because I have her number.
Yeah. She's going to get this podcast. I'm going to personally send it to her and say, you remember this doctor that you had come in? Well, he's with Partner MD now. Now he's focused on the patient. I mean, you were focused on the patient before.
It really is a small world.
Yeah, it is. Absolutely. Well, I want to let you get back to your patients. I want to thank you for taking the time out to speak to our viewers and to really share some important things about, how Partner MD and how concierge medicine and yourself are really adding value to the marketplace and to people that want it. I mean, it's a choice. You always have choices.
And, we all We also offer what are called meet and greets, which, you can,
Yeah, exactly.
no obligation to that. So we just
Yes.
for half an hour. It becomes, you can talk to Dr. Todd, you can talk to myself.
Yeah.
Sometimes it's in person. Some people, I had one earlier today where somebody came in person, just wanted to sit and talk and meet and have a conversation.
Yeah.
Or it can be through Zoom, so you don't even have to either leave your home or your office.
Right.
And so I get, it's so if you have questions about it, or just questions about, whether your condition will be appropriately treated or something like that, feel free.
We'll put a link into like I think you do them quarterly or whatever. I don't know but so our people can know that there is a meet and greet. I've always believed in getting to know people and just kind of asking them questions. And so that might be a way for our viewers to at least get an understanding of you and your team and just the whole concept that you have.
For me, it was actually a new concept until I reached, after I reached concierge medicine, I was like, oh, meet and greet, it makes sense. People can
Yes.
like, this is what kind of experience that they would be getting.
Yes.
And I love it. And it also helps me familiarize someone with their story, so that when I actually see them for the first time as a practitioner,
Right.
as their primary care physician, then I'm already familiar and I already have a sense of where we might be going, but we can still start fresh.
Yeah, that's so good. Well, Dr. Sarma, thank you so much for the time that you spent with our viewers, and we really appreciate what you're doing over there, and we thank you so much. And we got to have you back on in the future to discuss maybe a little bit deeper of my journey through your y'all's concept, because so far I feel like I'm in fairy tale land. So that's okay. I like it. So thank you so much. We appreciate you, and thank you for our viewers to tuning in and listen to us. Okay, thank you.
Thank you.